of all say thank you to you so much for accepting my request for this. And I would introduce everybody to Dr. Anu. Dr. Anu Bansal is renowned gynecologist and laparoscopic surgeon. She is MBBS, MS with more than 15 years of international experience in India and UAE. And she has treated thousands of patients with the pelvic inflammatory diseases, uterine cancer, ovarian cancer, then a lot of complex diseases which I'm not able to pronounce name. Some infertilities are there, cervical cancer is there, endometriosis, some really complex names are there. But she has treated all these complex diseases for thousands of patients. I'm one of her patient actually, because I'm seeing her for quite some time. And recently my daughter's soon she'll be 10-year-old. So I was just thinking, okay, I need to go for this vaccination for my daughter. And this is how the whole concept started and this whole idea started. So I'm really thankful to you, Dr. Anu, for accepting the request. And it's definitely going to help everyone. And we'll record this session and upload it, so it will be helpful later also to people. And please post your questions on the chat so that we can take as we proceed. So to begin with, Dr. Anu, what exactly is this cancer and what is the reason that awareness for this is so little?
First of all, thank you, Ms. Neetu. It's my pleasure and to share my knowledge about cervical cancer. So cervical cancer is one of the leading cause of death in females, and it is the most cause of cancer in women, like first after breast, lung, and colon rectal cancer. Oh. So what is cervix? It is the lowermost part of uterus which connects uterus to the vagina. This, okay? And the cells present there are prone to get infected, and they can lead to cervical cancer. So most common cause of cervical cancer is human papilloma virus. It is a DNA virus, and everybody is exposed to this virus after our sexual activity begin. Okay, but our body immune system clear it. Like we get infection and we clear it. Okay. But in some people, due to unknown reason, we don't know, this human papilloma virus will survive for years, and it can cause some changes in the cervical cells. They become cancerous cells. First precancerous, then cancerous cells.
Oh, okay. So since the causes are unknown, can it happen to anybody, irrespective of age or
No. It can happen. As everybody is exposed to virus, but some person maybe due to weak immune system, or maybe like in HIV or some infections, diabetes or poor lifestyle, diet, they are more prone. Or some I'll tell you some risk factor. There are some risk factors, like why everybody is not getting infection, why only few people are exposed to this. Reason is, if we have many sexual partners, more sexual partners, more risk of infection, more risk of human papilloma virus, and more chances of cervical cancer. Then early sexual activity, we get exposed to this virus after the sexual activity. So early sexual activity will increase the chance of cervical cancer. Other is sexually transmitted diseases. If we have syphilis, gonorrhea, chlamydia, these all lead to increased chances of human papilloma virus infection and then cervical cancer. Then weak immune system, I have already explained. And then smoking. Smoking definitely increases the chance of cancer.
Okay. So people like those who are having these things, they should be regularly going for the checkup because they are more prone to this thing.
Yes. Okay. They should be regularly checking. So I'll explain symptoms of cervical cancer first, or any precancerous lesions. like vaginal bleeding after intercourse, or abnormal spotting or bleeding between the periods, or any type of bleeding after menopause. So we should go to the gynecologist. Next, any bloody, watery, or foul-smelling vaginal discharge, or any pain, pelvic pain, or pain during intercourse. One should go to the gynec.
Okay. Okay. I think many times people, we don't know, like we are not even aware of the symptoms. So people think it's just like a normal pain, and then we tend to ignore these things.
Yes,
That's the
yes.
challenge. Yeah.
So now see why we give stress to this cancer, because it is preventable and it is easily detectable 10 years from its formation. Like we can detect this cancer 10 years early at the precancerous stage when it is in the
Wow.
stage. So how first is detection by pap smear. Like according to the American Cancer Society and WHO, one should begin screening by pap smear once sexual activity begins every 3 yearly.
Okay.
Or after at 21 years old. Like if
okay, so before
begins
21
before
years,
21 years.
Before 21 years, they have to go every 3 years for pap smear
No,
test.
no. If it should be started after your sexual activity begin,
Okay.
or it begins before 21 years, it should be started at 21 years.
Okay.
Every year.
Okay. Every year.
Every 3 years.
Every 3 years. Okay.
And once you are above 30 years old, preferable pap smear plus HPV DNA testing, human papilloma virus testing every 5 years. That is better than routine pap smear.
Okay. So, doctor, pap smear test is different from HPV testing?
Yes. In pap smear, we check cervical cells which are lying on the cervix.
Okay.
But HPV test, we check if we have infection with the HPV virus DNA or not.
Okay. I never heard of HPV testing until I was like thinking of.
It is little expensive, and that is why we are not doing it routinely. If we suspect something on pap smear, then we do it.
Okay, so first screening will be like pap smear, and if there is some problem, then people can go for that.
Normally, we are doing it like it, but after 30 years of age, it is recommended. We should do both every 5 yearly.
Okay.
But it is not covered under insurance. HPV testing, it is little expensive, so it's okay if we are doing it pap smear every 3 yearly.
Right. So, doctor, as you explained, what are the risk factors? So, what are the ways that somebody can reduce those risk factors?
Sure. First is safe sex practice is very important. Like condoms you should be used. If we have any infection like STDs, it should be treated. Avoid smoking, and one of the most important is HPV vaccination. Like we have vaccine available for human papilloma virus.
Okay.
As per CDC, 2 doses of vaccination should be started at 11 years of age, 11 to 12. But it can be given at 9 years.
Okay.
Once there is 9-year-old, it can be given. Okay, and till 15 years of age, if she is below 15, 2 doses are recommended. If she is between 15 to 26, 3 doses are recommended. Like recommendation is between 11 to 26 years old. But if a woman is more than 26 years, less than 45, we can give vaccine.
So, doctor, like my daughter is now going to be 10 years. So, if like we go for the first dose now, when she's 10, so when we can take the second dose?
After 6 months.
After 6 months. So, after that, she
Minimum
doesn't have...
6 months.
Okay.
Like it should not be given before 6 months. It should be given after 6 months.
Okay. And like after that, she doesn't have to take any further dose?
No, nothing. But if she is more than 15 years old, then 3 doses are recommended.
Okay. And doctor, now I have one more question. Like somebody takes the vaccination, still do they have to go for after 21 years the pap smear test regularly once
Yes,
in
yes.
3 years?
We have three types of vaccine. Okay. One is Cervix, that is active against two strains of HPV virus. Like see COVID virus, and we have many strains of HPV virus. Like okay. So Cervix, it will active against 16 and 18, most common cause of virus cancer. Gardasil 4 against 4 strains, and Gardasil 9 against 9. Like it will cover maximum viruses. But we still have chance of getting cervical cancer by other viruses, other type of HPV DNA virus. So that routine screening should be followed routinely every 3 yearly.
Okay, okay. Yeah. Participants, if you have any questions, please just type your questions here so we can take that also along with my questions, because I have a lot of questions.
And one more
Yeah.
thing, this HPV vaccination, it will protect against warts. Like 80 to 90% cases of genital warts can be protected by HPV vaccination. And precancerous conditions of cervix like CIN1, CIN2.
Okay, okay.
Like other,
That's
we have precancerous condition that can lead to cancer later on. This
okay.
vaccination can prevent us with this also.
Right, right. So, doctor, along with it, is there any vaccination available for any other cancer? Like, just out of curiosity, I'm thinking.
For female, breast, ovarian, lung, not available.
Yeah. So, I think we are really fortunate that this vaccination is available,
We
and
have.
I think
Yeah.
all parents
And
should give to their daughter as soon as possible.
And 90% of the, we can prevent 80 to 90% of the cancers with this. 80%.
Okay.
Not 100%, like I told.
That's really it's a blessing actually.
Sure, sure, sure.
Yeah. So as we discussed that, we have seen the age also. Now, if it's we give the vaccination little early by 10 year or 11 year, that does it impact the menstruation cycle in any way, or it doesn't
No,
impact?
it doesn't. It won't affect.
Okay,
It
so
doesn't
it remains same.
on the menstrual cycle or anything.
Okay, okay, and it doesn't help also in that, everything remains like that.
Yeah, yeah. It doesn't have any effect. I have given to my daughters.
Okay, okay.
Nothing.
Yeah. And if suppose somebody gets that cancer, unfortunately, then how much time does it take to develop?
Like?
Like somebody has got it, they did not take the vaccination and they have it, they got some symptoms. So how much time does it take to develop and reach to that critical
See,
stage?
from precancerous lesions of the cervix to cancer, it can take 5 to 10 years. We have long time. If on routine pap smear, if we suspect something abnormal, like precancerous cervical lesions, it will take long time, many years, and we have enough time to treat and to. So that is why pap smear screening is so important.
Okay.
It's not like that we detect something is abnormal and next month we get cancer. No, it's not like that.
Okay. I think Pragya has one question. She's asking, what is Gardasil? Gardasil.
Gardasil, it is a human papilloma virus vaccine. It's like 3 types of vaccine: Cervarix, Gardasil, and Gardasil 9. In UAE nowadays we are giving this Gardasil 9.
Okay.
It will help us.
Yeah.
Yeah.
So it can be given at from 10 years, the same vaccine that.
It can be given. It can be started from 9 years, but
Okay.
max the recommendation is from 11 years.
Okay. Yeah, but as you're saying that recommendation is from 11, so it's okay if we give for 10, it will not harm anything.
Yeah. No, it will not harm. It will not.
Okay, okay.
The recommendation is from 11 to 26, but we can give it from 9 to up to 45 years.
Okay, that's wonderful. I think one more question we have. I was ignorant by connecting cervical cancer to breast cancer. Are they both interconnected or are they different? How does cervical cancer?
No, they are different, not at all connected, nothing.
Okay. And does the cervical cancer also requires chemotherapy?
Yes, chemo, radio, surgery, everything, depending upon the stage.
Okay. And is it genetic? Like if the mother had the cervical cancer, so daughter can also get it?
No, it's not genetic. It is caused by infection.
Okay, okay. So that's
It is
also
caused by
like,
human papilloma virus infection. Like breast cancer is genetic.
ah, okay.
Like some things are genetic in breast cancer. In cervical cancer, it is not.
And like how it can be prevented after vaccination? Like one is that the pap smear we can like do after 21 years, but before 21 years, and no test is required once anybody takes the
Because
vaccination.
why no test is required? Because we get virus once we are sexually exposed.
Okay.
So that, not before that. And it takes long time for the cancer to develop. And when we are young, our immunity is very strong. So usually we clear it. So that is why we like one age is decided, like 21 years, we should start pap smear screening.
Okay.
Before that, very less chance of developing it, very less.
Okay.
And cervical cancer mostly occurs after 30 years of age. Before that, only precancerous lesions.
Ah, okay.
Age is between 30 to 50. Like it takes at least 10 years to develop. Told na 10.
Yeah. And now my next question is is the like suppose somebody has not taken the vaccination and they got married, and after that if they take vaccination, will it be effective for them?
Yes, it will be effective. Once we are sexually exposed, we get some strains of HPV DNA, maybe. But vaccine will protect against other viruses. So we'll get protection from other viruses. So it is effective, but effectiveness is less.
Okay.
But one should get it.
Uh-huh.
So that is why it is most effective when it is taken at the younger age, before the sexual activity.
Okay. Yeah, because I was like, I keep thinking, oh, my daughter's vaccination, so my brain goes there only.
No. Once till 45 years, we should take it.
And you explained that how often we have to do. So are there any, I'm not sure that these are covered in the insurance also. Different tests are
Pap smear is
covered in
covered most of
insurance.
the time. HPV is not covered. And
Okay.
vaccination is not covered.
Okay.
People are paying it, or maybe some companies are like offering or like that. Their companies are reimbursing.
Okay. Yeah.
Like that we get patients. Otherwise, not. It's not right now.
What is the percentage? What is the death rate in this? Like, if anybody gets it, how severe it is? Because
It is once you get cervical cancer, death rate depends on the stage when it is detected.
oh,
In stage 1 and 2, very good chances, early stage. But in later on, 3rd, 4th is less chances of survival.
okay.
Like if a patient comes to us with stage 1A, less chances, but almost complete cure is there.
Okay.
And removal.
Right.
So
I
that
think
is important to early.
Yeah. And I think it's really important because now very few things are there for which I think I never heard of any cancer's vaccination other than this. So I feel that if it's available, then one should definitely take it.
Definitely get it. Yes. Definitely.
Yeah. We have one more question. Can we have indicative cost of HPV vaccination and test?
Indicative means?
Like approximately how does it cost in UAE or
In UAE, vaccination is around 700. The Gardasil 9. We are giving it.
Okay.
And HPV DNA testing is around 700-800. Like it depends on how many strains you are testing.
Okay.
Like there are high risk strains, intermediate. But in Meteor Hospital, we are charging around 800 for HPV DNA.
Okay. And for that also the same vaccination is useful.
Like yes. Gardasil 9.
Yeah.
Gardasil
The
9
name
will
is so
protect
complex.
No. Only Gardasil 9 is available nowadays. And it will help protect against 9 viruses, 9 strains.
Okay.
And it covered most of the viruses that cause cancer.
Okay.
Like 16, 18, 53. These are the strains which cause high risk strains.
Right. So doctor, when we give the vaccination, does fever or something comes like, because normally for my daughter, we were giving vaccination on Thursday, so that Friday, Saturday we had off. So in case if she gets fever, like we'll have weekend.
No fever, nothing. Maybe mild pain because needle is very small. Mild pain on left arm, nothing else.
Okay. Yeah, I remember. But she's too young, so I was just thinking.
No, don't worry, nothing. No,
Okay.
like it is not like pediatric vaccines or like with fever and all. But it should be avoided in pregnancy.
Okay.
Okay, and or if you have any allergy to first dose, it should be avoided. Otherwise, no.
Okay.
It is safe.
So what kind of allergies can come, like if somebody
This is like if you have allergy to yeast or antifungals like that. But it's very rare. It's only theoretical I have seen, not practical.
Yeah, even I don't remember when I took vaccination, I did not have any like pain was there for a few seconds. That's it. It was
Yes,
like
because
perfectly
needle
fine.
is very small needle.
Yeah, that's right. That's right. So I think if you have any questions, participants, please ask, because I think I asked a lot of questions.
And one more thing, when we do pap smear, we get a lot of precancerous lesions like CIL, NITO, LSIL, high-S. We can treat this by surgery. So like we can remove that part of the cervix. That is why, so these are the surgeries, small surgeries, we can prevent cervical cancer.
Okay, so if somebody has it, like somebody got it, God forbid, so if they go through that surgery, it can be prevented. Like
yes, like we remove only that part of the like cervix with loop, leap. Many procedures are there, like small loop. They can we remove that.
Okay. And
If we detect cancer in precancerous stage.
And if somebody has like already some cancer, like the breast cancer, so for them, is it the chances are more to get this like cervic cancer?
Yeah, because they are taking medications, radiations, chemotherapies, or their immune system is weak.
Okay.
They are more prone to get cervical cancer.
And like suppose somebody had the family history of breast cancer. So breast cancer is, as you explained, that it's genetic, but like their children, do they have like the more chances of getting cervical cancer? That has no connection.
It's related to infection. No.
Okay. And when we started our discussion, you were saying that for boys also it's coming now. So how does it come?
Because boys can also get human papilloma virus infection.
Okay.
Hpv DNA virus infection.
Uh-huh.
So now recommendations are coming, and they will approve it for boys also.
Okay. So what age they'll be getting it?
Teens,
teenage, same age they'll be getting. Okay.
Because the Hpv DNA is causing warts, other anal cancers, other type of cancers also. So recommendations are coming, and it will come.
Okay. That's interesting, because I never heard about it. I thought only it's for girl children it is there, not for boys. That's very interesting. And it's like, it's really great because of science we are able to protect from so many things.
Sure. Yes.
Right. Yeah. If you have any questions, please type it here. So doctor, like somebody, if they have like diabetes or high cholesterol or other health, not diseases, I would say, but conditions like
morbidity. They are definitely diabetic, more prone to, because their immune system is weak.
Okay. So diabetes also has impact. So is there any other health factor which like makes them more prone to this virus? Like one is the diabetes.
STDs.
Oh, okay.
Because weak immune system, that human papilloma virus will cause cervical cells to change into cervical cancer cells.
Okay. And is it anyway related to stress also? Like if somebody's having the chronic stress for a long time, so does it impact some way?
Maybe little, like with stress, immune system is weak. We can't.
Right, right.
But as such, definitely there is no reason why some people are more prone and some are not.
Yeah, that's right.
Why some cells are get changed into cervical cancer cells and some not. But cause is definitely human papilloma virus.
Okay. And that virus, like, yeah, so at least we know that that is a virus, so the vaccination is available for it.
Yes, it's available.
Is it available in all the countries? Because I think some of people have joined from like Hungary and India and Dubai. So is it available like all over the world? Like,
All of the actually I don't know this, but definitely in most of the countries it is available. India, America, everywhere it is available. All countries I don't know, all over the world.
Yeah. Because 2 vaccination I got in India and 3rd in Dubai. So that
okay. Earlier we were using Cervix and Gardasil 4 when I was in India. Now we have started Gardasil 9. Maybe.
Okay. So somebody has got like, I got the vaccination for cervical one. Now Gardasil, do I need to take or I don't have to repeat it? It's fine if somebody has taken one vaccination.
It's okay, but only thing is Cervix is against 2 cells, against 2 human papilloma virus strains. Gardasil is against 9.
Okay.
Choice if you want to take whole course.
Okay. So it's okay if we repeat like the second also. Let's say that Gardasil one also, if somebody repeats, that's fine.
It's okay. So because your protection will increase.
Yeah. And as you mentioned that it protects against other viruses also. So I think, yeah, it is something, it's a package deal.
Yeah. Other viruses plus warts, against warts and other precancerous conditions.
Right, right. Yeah. That's very interesting, actually. It is so much information. I think like we need to have all these things, these awareness sessions, schools and colleges, especially when the young girls are there. This awareness session should be more.
Their parents.
Yeah. Because I was really surprised when I was telling like my friends and they have daughters and I was telling them that have you got it done? They said, no, we don't, like doctor did not say, we don't know that it is there. So it was quite surprising. I kept reminder in my phone for my daughter. So I'm just waiting for next month is her birthday. Next day for her birthday, I'll take her.
Good, good.
Because I have the habit of forgetting. So I don't want to forget. That's why if I take one dose, I'll remember that I have to take the second one.
How old is she?
Now she is going to be 9 in February.
She's
yeah. So her birthday is coming.
Okay. After that, she can take it.
Yeah. So that's why I thought, okay, I can like start with this one.
Sure.
Yeah. So in UAE, do we have like, as you mentioned that the treatments are available, but other than the chemotherapy, what are the different treatments? One is you said the early stage, there can be surgery. The later stages, say chemotherapy. Is there any alternative?
Chemo and radiotherapy.
Chemo and radiotherapy.
Yes.
Yeah. If you have any questions, you can type, please. I think it was really like very informative. I did not know about many things. Now I'm thinking I should also go for the second dose. Yeah, and I'll definitely record it. We are recording, so we'll share it with I'll upload it on YouTube and share link with you and with everybody who has joined today. So it is really definitely going to help. Thank you so much, doctor. I'm so glad. I'm really very thankful to you and thankful to everybody who joined. I think like the questions no more questions are coming, so maybe I'm so thankful to you.
Thank you. We can do it again, so no problem.
Yeah, those who have joined, I just want to say that the 30th January on Sunday, we have kept the annual regular health checkup webinar also with Dr. Priyanka. So if you please join it, because in that we'll be discussing in detail about what all things like who need to go for regular health checkup and all the details. So how we can prevent diseases, like and detect them at the early stage. So yeah. Because that also I thought that okay, many people are not going for routine health checkup until we fall sick, like for cervical cancer also, until people are in the extreme stage, then only people realize that we need to see doctor. So we thought okay, we'll have that also.
Sure. I'll
thank you,
join.
doctor. Thank you so much.
Thank you very much. Thank you. Bye.
Thank you.